Hello everyone, my name is Zina Abdulkadir, but everyone calls me Z. Today I'll be going over my week 3 discussion for Dr. Williams' Information 685 software requirement from Mercer University. Today's discussion I'll be going over several things. The first thing I will be going over is I will play a role as a business analyst to help my healthcare hospital to improve existing inpatient prescription process. And then within my recording, I will basically talk about the models that I will be using for elicitation analysis and specification of the user requirement for the models and why I recommend them. For my healthcare hospital, I would recommend for this organization as a business analyst to basically invest in an electronic prescribing medication application or software. The software will basically be able to collect patient data, patient information about medical history, prior medications that they're currently taking. This application will also be able to locate local pharmacies in which the patient, local pharmacies for when the patient does get out, they're able to get their prescriptions, being able to record all their medical history and using an electronic medical record and incorporating within the care. I would also use a clinical decision support system in determining what medication is best for the patient to use, depending on their diagnoses, depending on surgical history, depending on medical history, depending on allergies. I want all this information to be able to be used when prescribing the medication. Another thing that I wanted to quickly go over was our also week 3 discussion. We talked about we were able to choose 2 electronic medical records and 1 electronic medical record and 1 electronic health record, and the 2 that I chose was McKesson and Cerner. I chose these 2 clinical documentation systems and application. I personally have history with both of them. Working as a bedside nurse, the organization I currently work for was, well, technically we are still using McKesson, but we are within this fall we will be transferring over to Cerner. So I was able to have the ability to look at both applications, and I found that both applications were great when it came to documenting for nurses and also physicians when ordering medication, when being able to communicate with pharmacy, being able to look at radiological testing and laboratory values. I found this to be very helpful. A few key benefits I found with McKesson was you're able to document allergies, and you're able to document diagnoses. You're able to document surgical and medical history, and that will also format within the pharmacy HEO system when ordering. So if there's any discrepancies with past surgical history, such as getting a GI band or having gastric bypass surgery, those patients are unable to take NSAIDs such as ibuprofen, Aleve, Advil. So if you were able to put in the information to prescribe Advil, then that will cause an error, which will decrease medical error and medication errors, and this will cause basically a patient safety net for the medication administration process. For Cerner, I really haven't had the time to really dig in, but I've heard really great things when it came to the EMR system, and I've heard key benefits when it comes to delivering care and repetitive documentation, where this will be decreased since there is basically an increase in like care coordination and being able to look at past documentation, so it will decrease this redundant documentation that we see as nurses. Thank you.